Case vignette: hypothyroidism. A 45-year-old woman presents to the clinic with complaints of fatigue, weight gain, constipation, dry skin, and cold intolerance over the past 6 months. She also reports feeling more depressed and forgetful. Her menstrual cycles have become irregular, with heavier and prolonged bleeding. On physical examination, BP 120/75 mm/Hg, HR 58 BPM, temp 97.2 degrees Fahs. The skin is dry and coarse. Mild periorbital puffiness is noted. Reflexes show delayed relaxation phase. The thyroid is mildly enlarged but non-tender. Laboratory result: TSH 12.8 unit per milliliter, elevated normal 0.5 to 5.08 milliliter. Free T4 0.5 nanogram, low normal 0.8 to 1.8 nanograms. TPO antibodies positive. The patient is diagnosed with primary hypothyroidism due to Hashimoto's thyroiditis. Which of the following best explains the pathophysiology of this patient's condition? A. Autoimmune destruction of thyroid tissue leading to decreased hormone production. B. Pituitary adenoma causing reduced TSH secretion. C. Iodine excess leading to thyroid suppression. D. Increased TSH receptor stimulation by autoantibodies. Answer: rationale. Hashimoto's thyroiditis is an autoimmune disorder where TPO antibodies attack the thyroid, leading to progressive destruction of thyroid follicles and decreased 3,3-T4 production. This results in elevated TSH as the pituitary attempts to compensate. Question 2. What is the most appropriate treatment for this patient? A. Methimazole. B. Radioactive iodine ablation. C. Levothyroxine replacement therapy. D. Beta blockers. Rationale. The treatment for primary hypothyroidism is levothyroxine, synthetic T4, to normalize TSH and improve symptoms. Methimazole A is for hypothyroidism. Radioactive iodine B worsens hypothyroidism, and beta blockers D are not a primary treatment. Question 3. Which of the following is an expected finding in untreated severe hypothyroidism? A. Hyperreflexia. B. Increased cardiac output. C. Pitting edema, myxedema, exophthalmos. Rationale. Myxedema, non-pitting edema, occurs due to glycosaminoglycan accumulation in the skin, leading to swelling, especially around the eyes and hands. Hyperreflexia A and exophthalmos D are seen in hyperthyroidism. Hypothyroidism causes decreased cardiac output B. Question 4. A patient with long-standing hypothyroidism is brought to the ER with confusion, bradycardia and hypothermia. Which of the following is the most appropriate initial management? A. Oral levothyroxine. B. I4 hydrocortisone only. C. IV levothyroxine and IV hydrocortisone. D. Beta blockers and fluids. Rationale. The patient has myxedema coma, a life-threatening emergency requiring IV levothyroxine T4 and IV hydrocortisone to prevent adrenal insufficiency if undiagnosed. Oral therapy A is too slow in an emergency. Would you like any modifications or additional questions?